Welcome, everybody. Hello, good evening. My name is April, and I'm with MedWell Health and Wellness Centers, and I'm so excited tonight to bring you MedWell Unscripted Florida edition. We've been doing our live Unscripted in Massachusetts for a few weeks, and now every other Tuesday night, we get to bring you our friends from Florida and share with you everything that's going on in the cannabis industry and the medical marijuana certification. So tonight, I have Nicole Stewart, our Director of Community Outreach. And hello. Yay. I'm so excited that you guys are here tonight. And we also have Jill Long, who is our medical assistant, patient care coordinator. So ladies, I'd really like to start out the top of our time together, just talking a little bit about your positions and what you do. And just from housekeeping friends that are watching us live, just so you know, please feel free to answer questions in the comments area. We will definitely make sure that we get to them. The whole point is to answer all the questions that you have tonight about medical marijuana certifications. All right, Nicole, let's kick it off. Tell everybody about all the good things you do.
Hey, thank you, April. Thank you for the introduction. So happy to be here. So, of course, I do community outreach here in Florida, and I can't say how much I love my position with MedWell. We are definitely the best organization, I like to say. So my position entails going out into the community and getting involved as much as I can. Of course, meeting with physicians, oncology, neurology, orthopedics, GI specialists, and so forth, to let them learn about the benefits of medical cannabis with their patients, trying to break that barrier through. I also visit plenty of veteran-owned businesses. I'm a huge supporter of the veterans. And of course, we do health fairs. We try to get as much into the community, whether it's a healthcare fair for senior citizens, whether it's a senior citizen community that actually calls MedWell and says, hey, can you come and educate our staff and our residents about medical cannabis? Because of course, our demographic here in Florida is 50 and over. So they have a lot of qualifying conditions and looking to make the golden years a little bit better. So we are happy to provide that for them.
Awesome.
We also do, just anything and anywhere where I can get out into the public, visiting dispensaries, seeing the discounts that they're offering so I can relay that to our patients, which, is a great program that they provide with different kind of discounts for their patients and wonderful discounts. I have to say that the dispensaries here in our community are very tight, and they all communicate with us, and they're all great friends. So it's MedWell, me carrying our message to the public: education, 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 and certainly getting MedWell's name out there.
Awesome. And you know what? I believe we are in our anniversary year here too, which is awesome in Sarasota. So hats off to all of you. All right, Jill, share with us what you do and how you serve our clients and our patients, because you have a very special role in what you do.
Yeah, so I've worked a few different roles since being at MedWell, and I've been at MedWell for a year, almost a year.
See, it's your
I did
anniversary
marketing.
too.
Yeah, it's been great. Thanks to my aunt who got me into it. It's been really fun. I did marketing when I first started. I did marketing and community outreach. So we would do events together. I would go into different cancer centers, pain management clinics, dispensaries, just to, like she said, educate. It was all about education. And then COVID hit, so I started working from home, and I was doing booking telemedicine appointments for Massachusetts and or Florida. And then now I'm working in the office. I'm doing one-on-one patient care. I'm getting their charts ready. I'm getting them situated for their appointments. I'm making sure that they have all of the correct information, their valid Florida ID. You need to have a valid Florida ID. People need to start with the basics, and then we move on into, this is what you need for your appointment. Here's all the paperwork. So it's been fun. It's been definitely a journey, and I'm here for it. I love what I do. It's been a great experience. Being in the medical marijuana field, it's up and coming. So it's been very fun to learn and to grow with the company.
Awesome. Well, and I think, I think one of the biggest things that our team in Florida and Massachusetts, New York as well, the biggest thing that we do is customer excellence and patient care and really, solving people's pain problems with medical cannabis. So awesome. All right, my friends. So let's talk, I want to share with our viewers tonight and kind of educate them on how our process works, because, I think where there's lots of questions, people are sometimes intimidated to ask questions online, or sometimes even making a phone call, going outside of their comfort zone. But I want them to know how easy it is for them to kind of start the process, and also really understand how we schedule appointments and what the first steps, especially with COVID. So Nicole, do you want to share a little bit about how with COVID, how we have our in-office visits, and we also now offer telemedicine appointments, and kind of how that whole process works?
Sure. So, of course, with COVID, whoever expected something like that to happen? I mean, absolutely mind blowing. Of course, when it first hit, it hurt hit with a vengeance, and everybody was worried about, what are we going to do? How are we going to see patients? Because they need their medication, just like a diabetic needs their insulin. It's no different. And so luckily, the higher ups of our company had everything in place so we could instantly just hit that button and get telemedicine going so we could continue our care with our patients. So that was a big deal. Learning how to adapt, how to be more creative. But we offered that telemedicine right off the rip, got patients, they were so very thankful. And of course, in Massachusetts, COVID changed, they took recreational away. So our jobs here in Florida, we all came together as a company. Didn't matter, we were here in Florida, they were here in Massachusetts. We're an organization, we're one family. We all pitched in. We all bunkered down at home with our pajamas on and our hair in a ponytail, and took advantage of not having a dress for work. But we were very, very, very busy with Massachusetts patients because, of course, rec being taken away, they needed to get their medical cannabis card. So that helped out. In Florida, telemedicine came along shortly thereafter. So all of our roles kind of changed. Obviously, with COVID, we weren't going out into the public. So how do we reach the community and let them know who MedWell is and what are we going to do for them and how are we going to continue our excellent care for these patients and for new patients alike? So that was developed very quickly and implemented. We did have a few bumps, but that's to be expected. But we definitely rose to the occasion, and people were suffering. People were very full of anxiety, either lost their jobs or weren't quite sure what the next step was on how to go about doing anything. It was a different world here in Florida with the COVID and in Massachusetts, but we implemented that strategy. We won it. We did it. We tried our best, and I think that our team rose above and beyond, and I'm very proud of everybody at MedWell.
Awesome.
We really have. We have grown so much since,
we have.
Starting with the company. It's amazing what a year really did for us. And, I'm going to give a shout out to all of the Massachusetts people because I only know 4 or 5 employees. I've met them, but, we all work so well together and we're a team. We literally are a great team together. If one of us needs something, somebody, it's no question. It's no question.
Right.
So I'd really like to, and I don't mean to cut you off, Jill, but I want to kind of get into a little bit more specifics about like what to expect when they schedule an appointment. So when somebody calls the office, so say they're calling the office, what are the steps that we go through to schedule an appointment? Kind of what are the expectations behind the scenes in our conversations with that patient on the phone?
So I always ask if they have a valid Florida ID. If they say yes, I have to make sure that ID matches the address on there, matches their current address. Not on our part, but the state of Florida, they tend to deny applications if it doesn't match. So I like to start with that. If that's good to go, then we get into what qualifying condition do you have? We have epilepsy, cancer, glaucoma, HIV, ALS, MS. And then there is one qualifying condition like or similar. So that's where the anxiety, the depression, the chronic pain falls. Because then we can relate that to like or similar PTSD or like or similar MS for neuropathy if somebody has, numbness or tingling. So we really try to understand what the patient is concerned about and wants, the medical cannabis for. And if everything gets checked off, then we set them up with an appointment. We usually have a pretty, like people can get next day appointments. It's been nice. People are in and out. It's a process to get your card after your appointment. So we like to have those available slots if somebody needs it next day or same day appointment. It's been great.
So when you're talking about qualifying conditions, do they need a doctor's note coming in, or kind of what are I think there's 13 qualifying conditions in Florida. So do they have to show proof, or does our doctor certify them? Kind of how does that piece work?
So what happens is if a patient does qualify for one of the 13 qualifying conditions, most of patients have sought treatment elsewhere with harmful medications, addictive medications. We have plenty of patients that have come in and they have a list of, say, for mental health issues. Suppose they have anxiety or depression, insomnia, and their physicians have put them on Ambien and Xanax and so forth. And these patients are looking for an alternative, a holistic alternative way to do that. So under those diagnoses, we are most certainly able to qualify them for medical cannabis. Our physicians are trained, educated, very highly trained in medical cannabis. And when they talk to a patient and they have that one-on-one and discuss what the patient's going through, i.e., it's a vet, served in Afghanistan, they have post-traumatic stress disorder, and they're looking to us for help. And that's what we're providing them. We're providing them access to medical cannabis. And I have to tell you, April, the testimonies that we get when they're off and they're using medical cannabis and they're finding the right strain, working along with us in the dispensaries, that is the most rewarding thing to me. I love hearing positive testimonies. So
we have actually a friend here tonight, Fazza, and I'm sorry if I'm not pronouncing your name right. I apologize in advance, but they have a great testimonial here, so that's awesome. And I'll share that on the screen in a second. So John is asking, is it difficult to get a medical marijuana card? Because I think sometimes, where there's qualifying conditions and kind of the steps to go through the process, is it hard?
Honestly, it's not. If you have a qualifying condition that one of our physicians, thinks it would benefit you to get your card, it's a very easy process. We try to make it as easy as possible. After your appointment, it is a little long of a process when you have to register with the state, but that's what we're here for. That's where I stay in contact with our patients. I make sure that they understand what they're doing. If they don't, I'm going to step in and I'm going to help them do that. They can come to an office when we're not seeing patients and we'll help them with their whole registration process. So that is our goal, is to make it as simple, as painless as possible.
Awesome. Our friend Laura is asking, can I get recertified with telehealth?
Absolutely. So as long as they're with a patient within MedWell, they certainly can utilize our telehealth feature, which they can either call the call center and we can schedule for them, or they can go online and book themselves an appointment. So telehealth, yes, they can utilize that in the state of Florida for a recertification process. And we have been recertifying our patients with that. And I pray that they allow telemedicine for this industry for the long haul, not just because of COVID, but if you think about it, a lot of our patients either have a difficult time making it out of their home for whatever condition they may have, low immunity, they don't want to be exposed to the germs. So we absolutely hope that they keep that available to all medical offices. And medical marijuana is no different. It still has that stigma attached to it, but it really is no different. We are a professional organization. We strictly adhere to medical cannabis. We don't offer, any other things on the side like a massage or Botox. We strictly focus on that. So our focus is on the patient, and we take that in a very professional manner. And we strive for excellence. And we not only do that, April, by providing the physicians that really are knowledgeable and spend their time talking to patients. Patients are very nervous coming in, and we know that it's a different world. Right. And we've come a long way, but they still have a lot of anxiety. So it's nice that they can stay at home. They can see the physician in front of them, the practitioner, and have a nice conversation. And when they're done and they hear about all this wonderful benefits and how it's utilized, then they're much more comfortable. And afterwards they hug us and they say, "Oh my God, I was nervous over that day."
And that's the best.
It's very rewarding. For sure.
A lot of the times I myself or Jillian will take a patient into the dispensary because we're next to Move in Sarasota, which is a great dispensary. We're also next to Vitican in Bradenton and Curaleaf in St. Petersburg. So we actually can walk those new patients over, introduce them to the managers over there, and they get a private consultation. So really, it's just a very lax but caring, compassionate organization that we like to allude to our patients and new patients alike.
You know what I think I'm going to do? I'm going to quickly, because we've had some questions about telehealth and scheduling your appointments, I'm going to quickly share my screen and show you how easy you can do it right online. So give me 1 second here, and I'm going to share my screen, and you should see my screen now. Do you see my screen okay?
Yep.
All right. You shouldn't see yourselves. Do you see my screen? Yeah, you can see the website.
Yes, I do. Yeah.
All right. So friends, you're just going to go to medwellhealth.net, and from our homepage, if you click on this button, get your medical marijuana card, you can click Florida. And it's going to go to our Florida page where you can either schedule a telemedicine appointment or an in-office appointment, or you're welcome to give us a call. It's mobile friendly as well. And right here, it automatically shows you what appointments are available in our offices. We have our Sarasota office, Bradenton, St. Petersburg, and telemedicine. And you're just literally going to click on book a time, and it will walk you through step by step of finding the right appointment. So a new certification, a renewal, or if you are a U.S. military veteran too, because we do offer special discounts for our heroes that are very special and near and dear to us. And that's really it, friends. When you are on our site, though, if you have questions, again, you can hit the button up on top. We have our email address. Please do join us on social. We're so glad you're here on YouTube and Facebook tonight. We have information about our approved conditions, upcoming events, our FAQs, and the local dispensaries that are in the area, just so you know. So our website is really a resource for you not only to schedule your appointments, but have lots of information to share with you. So go to medwellhealth.net. All right, so we're coming back on here. And let's see. And so it's always interesting when you stop sharing your screen, we kind of move around, right? So now we're in like the 2 on top, 1 on the bottom.
Just making sure my messy room isn't included in this.
So April, I did want to share, which I think I left out, was about our discounts, our industry discounts to veterans. So, of course, MedWell is a huge veteran supporter. And twice a year in Massachusetts, they have the annual where they register vets for free, whether they're active or retired. And that is a huge service. And we did that last year for the first time here in Sarasota. And it's a great opportunity to get your medical cannabis card for free if you're a veteran. So watch our Instagram, watch our Facebook, so you can see when we have those events. Usually we advertise it about a month out. But every day, if a veteran is 100% service disabled, we certify them for free at no cost. And if that's huge, right? I know. And I get vets all the time that are 100% disabled and they say, oh, I already got my card. I'm sorry, but I'll come to you for a recert. And I said, well, you could have got it for free. And then they're like, oh, you're kidding. But it's a wonderful, wonderful thing that we provide for our veterans. Also, every day they are $50 off of all services. If they're 100% less, if they're under 100%, it's $50 off of their of our regular price. So it is still a wonderful deal. And also our industry workers. So if you work for a dispensary, if you work for cultivation or grow, or if you work for accounting, as long as you work for a dispensary like Curaleaf, Move, True Leaf, Grow, One Plant, MedMen, the list goes on and on. We have a lot of dispensaries. Columbia Care, can't forget them. You can get your medical marijuana card for $75 for a new or $75 for renewal. And we do that for all dispensary workers or industry workers, which is a great benefit to them because they work so hard. And they really are a wealth of knowledge, our dispensaries, right?
Absolutely.
They cater to everybody.
I feel like they just don't, they do a wonderful job. And of course, in this industry, you have to be passionate about it. And they are full of passion. Let me trust you. They have more passion. And they're there for the patient. And that's incredible. But, I think that they could get a little bit more recognition for the wonderful jobs they do and how
we can give them a shout out. Yeah,
so shout out to our dispensaries here.
And I think, and of course, thank you for our veterans too, because that's a small way of saying thank you for their service, for everything. Yeah. We have a question from our friend Natalia. How long does the certification last?
So in the state of Florida, certifications are good for 210 days, so 7 months at a time. So you do have to visit your marijuana doctor every 7 months. And then the registration process, which is your card, is once a year. So that's where it gets a little, confusing for some patients, but that's what we're here for. We do the education part. We make sure we do phone calls and emails and text messages to make sure people know, don't let it lapse. If you want to renew, make an appointment with us and we'll get that done for you.
Well, the great thing is that MedWell automatically calls patients. It's not a robot that you're getting. We actually call, which Jillian does. She calls patients and says, hey, you're about a month out of your renewal. Would you like to make an appointment to renew your card? And 99.9% of the time they say yes, because we're great. And we love doing it. And
a lot of people don't know. They're like, what do you mean? I'm like, it's every 7 months. It goes by really fast.
An interesting number that they picked. 210 days. But yeah. So one of the things, and I'm sorry, I don't mean to cut you off. So I just want to go back to the forms of ID, because I think that's one of the things that sometimes people are surprised. Like if I have an out-of-state license, but I live in Florida, and I know with military IDs, certain cards don't qualify for those IDs. Can you kind of explain what types of IDs they should have ready once they are scheduling their appointment and they come to their appointment, what they're going to need? Because usually telemedicine is a little bit different because they're going to submit that ahead of time. But when they come into the office, they bring it with them, correct?
Right. So we scan it in the office. It does have to be a valid Florida ID. If you do not have a valid Florida ID, if you are a seasonal resident that's here 31 days or longer out of the year, then we can certify you under a seasonal. You do have to have 2 forms, proof of residency, which I believe we have a link of those documents of what is acceptable to the state. But there is a way to do seasonal. It's just a little bit different.
For seasonal patients, which is a wonderful thing because we do have a lot of patients that live up north and they come here for a little bit, to escape the snow. We can certify them. We've had a lot of patients from MedWell in Massachusetts come to Florida and they'll be like, can't believe MedWell's here. Yeah, we're here. And we charge them $150 because it's dual residency. So if they live in Massachusetts and they come to Florida and they're a snowbird and they want to get their card, they just have to show a deed or a lease and an electric bill. And
Yep.
that's through you don't need a Florida ID at that point, but you do have to supply those 2 forms if you're a seasonal resident here in Florida.
Right.
Okay. So, and I know sometimes, when you talk about cost, is the medical marijuana certification card get covered by insurance? How does that work?
Unfortunately not. Insurance does not recognize medical marijuana to be covered. Hopefully that would change. But right now, our cost is $175, $150, or whatever discount may pertain to you. And then the state of Florida does charge $75 for that plastic card. And that is once a year you have to pay that. With tax, it's like $77.75.
Awesome. Thank you, Jill. So when a patient leaves our office and they're meeting with the doctor, how do, I think of kind of, we've educated them, we've helped them, they're on their way to now the next step is going to get their medication, right? So how does what's that kind of that transition to a dispensary? How do we help them transition and kind of what should they expect on the other side when they walk into a dispensary? I think that would be helpful to share.
What was great was when I was outside pre-COVID, a lot of the times I would walk a patient into the dispensary because they were nervous, especially in Sarasota where they're older. Jillian deals with a younger crowd. She does have a little bit of a senior citizen population there, but more younger in St. Pete, right, Jill? Sarasota's a little bit of the older demographic, but I would like to personally bring them in and hook them up with somebody right there and say, hey, would you mind giving this patient a consultation and show them around the dispensary? And they're happy to do so. They're happy to help out patients and show them. And when a patient goes up and sees like, wow, is that like an asthma inhaler? No, it's a device that you can use. It's not all, smoking. They have tinctures that you can put under your tongue. They have pills. They have patches. They have some incredible products, just like any other medication. So we like to take our patients, and the doctors especially do this as well. When they have their patients and they're talking to them, they show them different brochures from dispensaries that they give us of their favorite products and show them what they think may work. So we bring them. You can always tell which ones need a little extra TLC because they're nervous. And it is a scary thing at first, but when they go in and they see it's a beautiful store with nothing but professional people and great products, then it makes it a lot easier. So once you see them go in there once nervous, they leave like that was a breeze, and you see them every other day going back, and they wave to us like, they don't need us anymore. It's like our baby going to kindergarten. We're afraid to let go. They're like, bye, I got it. I'm good. But
because they know they're going to be feeling better in a short time, right?
Yes,
Exactly.
Go start low and slow is what we tell them. As new patients, you always want to start low and slow. You don't want to dive in and grab onto something that's a little bit out of your realm at that point. But the doctors are very good about telling patients that and how to use it and start. And we also offer free consultations afterwards. So if a patient goes to the dispensary and they get their medication and they feel like, wow, I'm not really feeling what I should feel, or it's making me a little nervous, then they can always come back to us for free, sit down with our doctor. We'll find another route. And again, it's not a clear-cut science. You're not going to walk into the dispensary and find what works for you right off the bat. If you do, that's fantastic. But 9 times out of 10, you're going to be trying different products in different dispensaries as well. So
awesome. So one of the things I'm not sure that we covered, we talked about telemedicine appointments, which is great, but what do people need when they schedule that telemed appointment? So can they use their phone? Does it have to be done on a computer? Do they have to download something? Because I think sometimes technology can be cumbersome for some, or that fearful, right? Like I know a lot about a lot of things, but when it comes to certain technologies, I'm terrible at it. So
So you can use a smartphone. It has to have a front-facing camera. You could use your laptop. It has to have a camera. As long as, so when you book your telemedicine appointment, you'll get an email. If you need to download an app, it's going to prompt you to do that. It does make you have either Chrome, Firefox, or Safari as a web browser. So we always double check, just to make sure there's no hiccups. We want it to go as smoothly as possible. So smartphone, front-facing camera, you could do it from an iPhone or an iPad, a tablet. Just make sure you have the right browser, or if you need the app installed, it's going to be there in the email that we send you. So it's a nice, easy way to get that on your device.
Awesome. So we have a question from our friend Warren. Is getting my MMJ card public information?
No, it is not. That would be a HIPAA violation. So absolutely not. It's just like any other doctor's office. And that's what I want to stress so much to the community or anybody that's thinking about getting their cannabis card. Only time somebody knows you have it is if you divulge it. A lot of questions I get asked as well. Is my primary care doctor, or is my, orthopedic, or is, are they going to find out I have it? And some patients feel that they don't want to tell their doctors because they're against it. I always try to tell them, you should talk to your doctor about it anyway, because you are adding something. So if your doctor doesn't approve, well, it's your choice. But they definitely is not open to public knowledge unless they make it public knowledge.
Which makes me think of on our FAQs on our website, one of the questions that gets asked a lot is, can you smoke in public?
No.
All right.
Still federally illegal.
Yeah. Go ahead, Jill. Sorry.
No, you're fine. It's still federally illegal. So it's not like just because you have your medical marijuana card, you can't be, smoking, driving. It's just like drinking. You can't be drinking and driving. But it is funny because some people do ask that, like, do I have free reign? No.
Right.
No.
We get asked a lot too. How do we travel with it? Can I fly with it? Can I, cross state borders with it? And again, just like Jillian said, it is not federally legal at this point, which we're hoping someday it will be. And to get it off of the drug screen is another thing that we're advocating for that needs to come off, because THC is now a prescribed medication. It is not an illegal drug, but in the federal government's eyes, it is. But I always say, traveling, no, you don't. I don't want to see you, go to jail because of me. You don't want to travel with it. It is, if it's federally regulated organization like the VA or the great old airports, you don't want to be traveling with medical cannabis.
I'm not surprised that's a commonly asked question.
It's They said I'm taking it anyway. So, well, I'm telling you no. So if you get arrested, don't
put my name in there.
Call Morgan and Morgan.
All right,
shout out Morgan and Morgan.
John is asking, will I receive any discounts for becoming a MedWell patient?
Well, the discounts we talked about earlier. So if you're a veteran, you're 100% disabled vet, you are for free. That doesn't cover the cost that they still have to pay the state $75. And discounts as far as first, we do first responder discounts. Jillian, what's the first responders? I don't remember. The first responders.
10% off.
10% off, and senior citizens as well.
Or $10 off. Senior.
$10 off. If they're a veteran, but they're under the 100% certification, 100% disability, then it's $50 off of services. So
sorry.
Good.
50% to 99% service disabled vets, we do their certification for $100. 100% service disabled, free certification. If you're, a veteran that's not service connected, 50% or 99, it's going to be $150 every time for new patients and renewals.
All right.
So we do have some, great discounts, and of course.
And also dispensaries, they do great discounts too for new card holders, veterans. They always tack on, I think it's 15%. So there are incentives to getting your card. Definitely. They take care of you for sure.
Awesome. Yeah. And I actually did drop the link to the local dispensaries here in Florida. So definitely check that out. We have a list of all of them locally, and actually some of their listings also have the discounts they provide, which is awesome.
Great.
So ladies, thank you so much for sharing all this information. I think it's super helpful for people to know that there's humans behind the phone, that even if you come to our website and you schedule an appointment, you are going to get a phone call. You are going to talk to a real person, and that we truly care about helping you. And that once you become part of MedWell as a patient, we are with you the whole way. And don't forget that. So we appreciate all of your feedback, your great questions. Thank you for all the kind comments tonight. Thank you, Nicole. Thank you, Jill. Friends, please definitely go to our website, medwellhealth.net. You can schedule your appointment, or if you have questions and you're not comfortable sending an email, feel free to call us. We are here to help you. And we look forward to seeing you every other Tuesday night at 7:00. And until then, friends, we will see you again. If you do leave a comment after we've gone off air, we will make sure we answer it and get back to you. So never fear, even if we're not live, we will make sure you get your questions answered. Have a great night, everybody. We really appreciate all that you do. And thanks for being here. See you later.
Thank you for having us, April.
Thanks, April.